Up to 90% of the members of Unite Here Union could lose work because of the coronavirus pandemic. Unite Here represents 300,000 gaming, hotel, airline catering, and hospitality's employees across this country.
The union has come out strongly against any legislation that would promote corporate welfare at the expense of American workers' needs. International President D. Taylor of Unite Here joins us now via Skype. Great to have you this morning, sir. Thank you.
Great to be here. Thank you.
Absolutely.
How are your members coping right now?
Well, they're scared. They're not working, and they don't know their future right now. So obviously we're trying to provide as much help as possible, but it's a very scary, uncertain time for members in our industry across America and Canada.
And so, Dee, we're learning some of the new details of this bill, the bailout bill that's been agreed to in Congress, about $2 trillion. How does that relate to your workers? I mean, are they satisfied with it? As the president, have you had a chance to review some of the details? What are the concerns and what are some of the benefits that you see in the bill?
Well, I've always said the American worker needs a bailout before corporate America. The little details I have seen are there's some good things in there, and I really want to thank Senator Schumer because he's really led the charge against the McConnell bill. But what is not in there is the fundamentally most important thing. We're in a healthcare crisis, and most people lose their healthcare insurance the last day of the month that they get laid off. So we're going to have millions of people go uninsured right now, right when they need healthcare. So either in the next bill or whatever, we need to address that issue because we're in a healthcare crisis and yet people are losing their healthcare.
Mm-hmm. Yeah, I think that's incredibly well said. And we've heard next to no debate, honestly, out of Washington about that very issue, which seems like an essential piece of what we need to get done here. Another thing that people have been talking about this morning is what they've agreed to is a $1,200 one-time payment. So no certainty that there'd be any further assistance, direct cash assistance coming. For your workers, many of whom have already been laid off or are facing being laid off, is that going to be sufficient?
Of course not. I mean, if you're in the D.C. area, you know $1,200 doesn't pay rent for 1 month. So that's great. It's great about expanding unemployment, which is needed. But we need some real solutions here. Expanded unemployment benefits, real money in people's hands on an ongoing basis. $1,200, if you don't have health insurance and you go to the emergency room, that money's gone. So I think there's some things that were achieved that are good. I don't want to knock those at all. But what was not dealt with was the fundamental reason why we have this crisis. This is not a financial crisis. This is a healthcare crisis. And yet nothing in there about healthcare and expanding healthcare and making sure continue to have healthcare right when they need it the most.
Mm-hmm. And so, Dee, what we're seeing, as you've highlighted the healthcare crisis there, but also in terms of the certainty. So the industry bailout argument has been, well, people won't have anywhere to work if we don't bail out these industries. What's your response to that? What are some of the protections for workers that weren't included in the bill?
Well, I think there's a few things. I think one, we wanted to make sure people could have continuation of their employer-based health care and the money go to the industry pay for that. Number two, housing insecurity. Most of our members live paycheck to paycheck, or just people in our industry. If they lose their job, they could be evicted by their landlord or lose their homes. That's a big issue. Number three, food insecurity. We want to make sure people can get food stamps in this time. And number four, we need federal sick leave pay. We have people here who choose often, should I go to work or should I stay home sick? Well, I have to go to work even if I don't feel well in this crisis. And when not feeling well could mean spreading the virus. And yet they go to work because they need to have that income. So we need federal sick leave pay. That all being said, I want to applaud the work of the Senate Democrats. And I frankly hold in contempt McConnell and the Senate Republicans who only looked at helping companies but not workers.
And at the same time, the president is signaling he wants to reopen the country by Easter. I'm sure a lot of your workers are very anxious to get back to work, to have a job to go to. But it goes against, of course, the advice of public health officials, especially when we're seeing cases continuing to spike and to surge. What is your reaction to his position on that?
Well, this is the same president who said this was hoax. And this is a liberal media thing to hurt his presidency. So he has no credibility to me. I want to listen to the healthcare experts like Dr. Fauci and those people who actually know about this disease and who aren't having a political lens, but have a healthcare lens. Because at the end of the day, you can reopen something, but no one's going to come if they think they're going to get the coronavirus and potentially be very, very sick. This is a healthcare crisis that has produced a financial crisis. Unless you go at the root of the problem on healthcare, it does not matter what we open up. People are not going to come, and heaven forbid we spread the disease even more. I think we have to have some tough medicine in order to have long-term back to normal and not try to have quick fixes. Let's listen to the healthcare experts. That's who knows about this, not this president, who frankly has no credibility, in my opinion, on this issue.
Well, Dee, thank you so much for joining us, telling us about your workers, and we hope that more assistance will come along the way. Appreciate you joining us.
We hope Washington's listening to you and to your members, Dee. Thank you very much.
Appreciate it.
Absolutely.
Coming up, Joe Biden's recent interviews. We got to talk about those. That's next.